Hello, I'm Jim Dover, President and CEO of Sparrow Health System. Last summer, when I last spoke to you via video about the pandemic, our COVID positive numbers had dwindled, but we were uneasily waiting for the next surge. Unfortunately, it has surged many times over. And we've been in a surge of patient and caregiver COVID cases in recent weeks that, combined with a staffing shortage, is putting unprecedented pressure on our health system and our caregivers. I want to briefly talk to you about how we're handling this surge, how we're shifting resources to cover our gaps, and what we're doing to shore up our frontline caregivers who have faced unrelenting demands for close to 2 years now. First, let's look at what we've accomplished. We've vaccinated 81% of our caregivers and over 153,000 community members, and we've provided COVID tests to over 725,000 community members. We've established the only monoclonal infusion clinic in mid-Michigan in an effort to reduce hospitalizations and transferred a number of patients from the Sparrow Hospital Emergency Department to our community hospitals. We have hired over 200 agency personnel to shore up our core staffing gaps and established a variety of incentive and bonus programs for caregivers to work extra shifts to address our patient needs. We've redeployed over 160 caregivers from their regular jobs to work in clinical and support roles. Financially, Sparrow spent in 2021 $50 million for all these efforts beyond what we received in reimbursement. Sparrow heroes are everywhere, from nurses, leaders, and other caregivers who work day after day on the front line of our COVID units to the non-clinical staff and others pitching in to help. We've tried multiple strategies with varying degrees of success, and we will continue because more caregivers means we can take care of more patients. We'll work on things like requesting more assistance from the government, continuing to redeploy our caregivers to the highest priority areas, changing the flow of patients in our emergency departments, and, just as importantly, balancing what we're able to do with available staffing. However, we simply cannot do more than our staffing allows, and we have to protect all of our caregivers from the enormous demands placed on them from the deluge of patients. We continue to place an enormous focus on convincing unvaccinated people to get the vaccine. Today, about 70% of our COVID inpatients are not vaccinated. As I've said in each of these video messages, there's something that's never going to change about our approach to COVID, surge or no surge. We will get through this the way Sparrow has always handled challenges, that is, together. We're here to support and assist you, and we appreciate your dedication and resilience as we care for the community. Thank you.